A 68-year-old retired teacher from Arizona just discovered she's been overpaying for Medicare by $2,847 every single year for the past 3 years. That's over $8,500 she'll never get back. Margaret thought she was being smart by choosing the most expensive plan, assuming it gave her the best coverage. She was wrong. And here's the shocking part: she's not alone. According to the latest Medicare data from CMS, 73% of seniors are making at least one of these 5 critical mistakes that are draining their retirement savings. The worst part? These mistakes compound year after year. If you're on Medicare or about to turn 65, the next 18 minutes could save you thousands of dollars this year alone. Some of these mistakes are costing seniors up to $4,200 annually, and Medicare has no obligation to warn you about them. Let me show you exactly what Margaret and millions of other seniors are facing. I'm going to walk you through each of these 5 mistakes using real Medicare documents and cost comparisons. By the end of this video, you'll know exactly how to audit your own Medicare coverage and potentially save thousands starting with your next enrollment period. Mistake number 1: staying with original Medicare without supplement coverage. The first mistake is one that 28% of Medicare beneficiaries make, and it's costing them an average of $1,200 to $3,400 every year. They stay on original Medicare Parts A and B without adding either a Medicare supplement plan or switching to Medicare Advantage. Here's why this is financial suicide. Original Medicare only covers 80% of your medical costs after you meet your deductibles. That means you're responsible for 20% of everything, and there's no limit to how much that 20% can cost you. Let me show you what this looks like in real numbers. If you need a hip replacement, the total cost might be $50,000. Medicare pays 80%, which is $40,000. You pay the remaining $10,000 out of your own pocket. But it gets worse. If you need multiple procedures in the same year, those 20% payments add up fast. A heart bypass surgery can cost $70,000. Your 20% share, $14,000? A cancer treatment plan can run $100,000 or more. Your share could be $20,000 or higher. Without an out-of-pocket maximum, there's no protection against catastrophic medical bills. Now look at this comparison. The same person with a Medicare Supplement Plan G would pay a monthly premium of about $150, but their out-of-pocket costs for that $50,000 hip replacement would be just the Medicare Part B deductible minus $240 in 2025. That's it. Let's do the math. Plan G costs about $1,800 per year in premiums, but it could save you tens of thousands in medical bills. Even in a healthy year, the peace of mind alone is worth it. In a year when you need significant medical care, it could literally save your retirement. The key insight here is this: original Medicare is not comprehensive coverage. It's catastrophic coverage with gaps that can bankrupt you. Don't make the mistake of thinking Medicare alone is enough. But here's where it gets even more expensive. The second mistake builds on the first one. Mistake number 2. Choosing the wrong Medicare Advantage plan. Medicare Advantage sounds like a great deal. Low monthly premiums, sometimes even $0. But 41% of seniors who choose Medicare Advantage pick the wrong plan and end up paying $1,800 more per year than they should. Let me show you exactly what to look for. The biggest trap is network restrictions. That $0 premium plan looks attractive until you need to see a specialist who's out of network. Suddenly, that free plan is costing you $300 to $500 per specialist visit. Here's a real example. John chose a Medicare Advantage plan with a $0 premium because it seemed like a good deal. His cardiologist wasn't in the network, but the plan told him he could still see the doctor. They just didn't mention it would cost him $400 per visit instead of $20. John sees his cardiologist 4 times per year. That's $1,600 in extra costs he didn't expect. Add in the out-of-network costs for his cardiac tests, and John's free plan is costing him over $2,000 more than a plan with a $30 monthly premium but better network coverage. Then there's the prior authorization trap. Many Medicare Advantage plans require prior authorization for specialist visits, certain procedures, and expensive medications. This means delays in your care while the insurance company decides whether they'll approve your doctor's recommendation. Margaret, the teacher I mentioned earlier, had her MRI delayed by 6 weeks because her Medicare Advantage plan required prior authorization. 6 weeks of unnecessary worry and pain while bureaucrats reviewed her case. The third issue is geographic limitations. If you travel frequently or spend winters in a different state, many Medicare Advantage plans won't cover you outside their service area except for emergencies. Here's what you need to know. Medicare Advantage can be a good choice, but only if you pick the right plan for your specific situation. Don't just look at the premium. Look at the total cost, including out-of-network charges, your doctor's network participation, and the plan's prior authorization requirements. And never, ever choose a plan just because it has a $0 premium. Those plans make their money by restricting your choices and shifting costs to you when you need care most. Mistake number 3. Ignoring the Medicare Part D donut hole. This third mistake is the most confusing, and it catches seniors completely off guard. It's called the coverage gap, or the donut hole, and if you take expensive medications, this mistake alone can cost you $3,000 to $4,200 every single year. Most people don't even know it exists until they're stuck in it. Here's how the donut hole works. In 2025, after you and your plan together have spent $2,000 on covered drugs, you enter the coverage gap. Once you're in the gap, you pay 25% of the cost for brand name drugs and 25% for generic drugs until your out-of-pocket spending reaches $8,000. Let me show you what this means with real numbers. Say you take a medication that costs $300 per month. For the first 7 months of the year, your plan helps pay for it, and you might pay $50 per month out of pocket. But once you hit that $2,000 threshold, which happens around month 7 if you take expensive medications, suddenly you're paying 25% of that $300, which is $75 per month. That doesn't sound terrible until you realize you'll be paying that higher amount for the rest of the year. But here's where it gets really expensive. If you take multiple costly medications, you can hit the coverage gap much earlier. Some seniors hit it by March or April, meaning they pay higher costs for 8 or 9 months of the year. Sarah from Michigan takes 3 medications that cost a total of $800 per month. She hits the coverage gap in February. From March through December, she pays an extra $200 per month in medication costs. That's $2,000 in additional expenses she wasn't expecting. The cruel irony is that the people who need the most medications, those with chronic conditions like diabetes, heart disease, or cancer, are the ones who get hit hardest by the coverage gap. But here's what most people don't know. You can plan for this. Some Part D plans have lower deductibles but higher premiums that actually save you money if you know you'll hit the gap. Other plans cover generic drugs better during the gap period. The key is to calculate your total annual drug costs, including the gap period, when choosing your Part D plan. Don't just look at the monthly premium. Look at your total out-of-pocket costs for the entire year, including the months you'll be in the coverage gap. If you take expensive medications, spending an extra $30 per month on your Part D premium could save you $1,000 or more in gap costs. But most seniors never do this calculation, and it costs them thousands. Mistake number 4. Missing the Medicare enrollment deadlines. The fourth mistake is devastating because once you make it, you're stuck with the consequences for life. It's missing Medicare enrollment deadlines, and the government penalizes you permanently. I'm not talking about a one-time fee. This penalty follows you for as long as you have Medicare. Here's how the penalties work. If you don't sign up for Medicare Part B when you're first eligible, which is usually the 7-month period around your 65th birthday, you'll pay a 10% penalty for every 12-month period you were eligible but didn't enroll. Let me show you what this costs. If you delay Part B enrollment by just 6 months, you'll pay a 10% penalty on your Part B premium for the rest of your life. If your Part B premium is $174.70 per month in 2025, that 10% penalty adds $17.47 to your monthly premium forever. That might not sound like much, but remember, Medicare premiums increase every year, and so does your penalty. Over 20 years, that 6-month delay will cost you more than $5,000 in penalty payments alone. But wait, it gets worse. If you delay by 18 months, your penalty becomes 20%. Delay by 30 months and you're paying a 30% penalty for life. I've seen seniors paying $300 or more per month in penalties just because they missed their enrollment deadline. The Part D penalty is different but equally permanent. For every month you go without creditable prescription drug coverage after your initial enrollment period, you pay 1% of the national base beneficiary premium as a penalty for as long as you have Medicare Part D coverage. In 2025, that's about 35 cents per month for each month you were late. Again, that doesn't sound like much until you realize it's permanent and compounds over time. Here's the tragedy. Many of these penalties are completely avoidable if you understand the rules. If you're still working at 65 and have creditable coverage through your employer, you might qualify for a special enrollment period that lets you delay Medicare without penalties. But here's the catch. Your employer coverage has to meet Medicare's definition of creditable coverage. Many people assume their employer plan qualifies without checking, and they get hit with penalties later. The most expensive version of this mistake happens when people think they can just wait until they retire to deal with Medicare. If you retire at 67 and haven't enrolled in Medicare, you'll face penalties that could cost you $10,000 or more over your lifetime. Don't let the government penalize you for the rest of your life because you missed a deadline. The rules are complicated, but the penalties are permanent and expensive. Mistake number 5. Not comparing plans during annual open enrollment. This final mistake is the one that Margaret from Arizona made, and it's the most expensive. Every October through December, Medicare gives you a chance to review and change your coverage. But 67% of seniors never compare their options. They just stick with what they have, even when better, cheaper plans become available. This set-it-and-forget-it mentality is costing the average senior $1,847 every year. Here's why this is so costly. Insurance companies change their plans every single year. The plan you chose last year is not the same plan this year. Networks change, costs change, and coverage changes. Let me show you exactly what I mean. Margaret chose a Medicare Supplement Plan F in 2018 because it had the best coverage and a reasonable premium of $180 per month, but she never shopped around during the annual enrollment periods. By 2024, that same Plan F was costing her $287 per month, a $107 monthly increase over 6 years. But here's the kicker. Plan G from a different company was offering virtually identical coverage for $159 per month. Margaret was paying $128 more per month than she needed. That's $1,536 per year in unnecessary costs. Over 6 years, her failure to shop around cost her over $9,000. But it's not just about premiums. Drug formularies change every year too. The medication that was covered with a $10 copay last year might jump to $50 this year, or it might not be covered at all. Robert from Texas learned this the hard way. His diabetes medication was a Tier 2 drug with a $15 copay in 2023. In 2024, his Part D plan moved it to Tier 4 with a $75 copay. That change alone cost him $720 more per year. If Robert had used the Medicare Plan Finder during the annual open enrollment period, he would have discovered that 3 other plans in his area still covered his medication as a Tier 2 drug. His failure to compare plans cost him hundreds of dollars. Network changes are another expensive surprise. Dr. Johnson, Margaret's cardiologist, was in network with her Medicare Advantage plan in 2023. But in 2024, the plan dropped her cardiology practice from their network. Now Margaret has 2 choices: find a new cardiologist or pay out of network costs of $400 per visit. If she had reviewed her plan during open enrollment, she could have switched to a plan that still included her doctor. Here's what most seniors don't realize. The Medicare Plan Finder on Medicare.gov updates every year with the new plan information. You can compare all your options in one place, including costs, coverage, networks, and drug formularies. The tool will even calculate your estimated annual costs based on the doctors you see and the medications you take. This isn't guesswork, it's precise cost comparison using your actual healthcare needs. But here's the most important part. Changes you make during annual open enrollment take effect the 1st of January of the following year. Miss this window and you're stuck with whatever you have for another entire year, unless you qualify for a special enrollment period. The bottom line is this: treating Medicare like a set it and forget it decision is one of the most expensive mistakes you can make. Plans change, your health changes, and your needs change. The only way to ensure you're getting the best value is to review your options every single year during the annual open enrollment period. Now that you know these 5 costly mistakes, let me walk you through exactly what to do about them. I'm going to give you a step-by-step action plan that you can start using today. Step 1. Audit your current coverage. First, gather all your Medicare documents, your Medicare card, summary of benefits, and any insurance cards you have. You need to understand exactly what coverage you have right now. Ask yourself these critical questions. Do you have just original Medicare? Or do you also have a Medicare supplement plan or Medicare Advantage? What's your total monthly cost including premiums, deductibles, and typical copays? Are your current doctors in your plan's network? Are your medications covered, and what do you pay for them? If you can't answer these questions easily, that's a red flag that you need to take a closer look at your coverage. Write down your current total annual costs. Include premiums, deductibles, copays, and any out-of-pocket maximums. This is your baseline for comparison. Step 2. Use the right tools. The Medicare Plan Finder at Medicare.gov is your most powerful tool. It's free, it's official, and it has every plan available in your area with current pricing and coverage details. But don't try to navigate this alone if you're feeling overwhelmed. Every state has a state health insurance assistance program called SHIP that provides free, unbiased Medicare counseling. These counselors don't sell insurance, so they have no financial incentive to steer you toward expensive plans. You can find your local SHIP counselor by calling 1-800-MEDICARE or visiting shiphelp.org. They'll help you understand your options and use the Plan Finder tool effectively. Step 3. Create your comparison strategy. When comparing plans, don't just look at monthly premiums. Calculate your total annual costs, including premiums, deductibles, copays, and out-of-pocket maximums. Start with your medications. Enter them into the Plan Finder to see which plans cover them and at what cost. If you take expensive drugs, pay special attention to coverage gap costs. Next, check your doctors. Make sure they're in the network of any plan you're considering. An out-of-network specialist can cost you thousands more per year. Finally, consider your travel patterns. If you spend time in different states, make sure your coverage will work where you need it. The goal isn't to find the cheapest plan. It's to find the plan that gives you the best value for your specific healthcare needs and budget. Remember, you can make changes during the annual open enrollment period from the 15th of October through the 7th of December each year. Mark these dates on your calendar right now. Margaret saved $2,847 her first year after making these changes, but more importantly, she now has better coverage and peace of mind. She knows her doctors are in network, her medications are covered, and she won't face any surprise medical bills that could devastate her retirement savings. These 5 mistakes are costing millions of seniors thousands of dollars every year, but now you know exactly how to avoid them. The next annual open enrollment period starts the 15th of October. Don't let another year go by making these expensive mistakes. Your retirement savings depend on getting this right. You've worked too hard and saved too long to let Medicare mistakes drain your financial security. Take action on what you've learned today and protect the retirement you've earned.